Malaria. Causes, symptoms, diagnosis, treatment and prevention. What is malaria? Malaria is a serious disease that spreads when you're bitten by a mosquito infected by tiny parasites. When it bites, the mosquito injects malaria parasites into your bloodstream. The disease is rare in the U.S., with about 2,000 cases per year. How common is malaria? Malaria is common in tropical areas where it's hot and humid. In 2020, there were 241 million reported cases of malaria throughout the world, with 627,000 deaths due to malaria. Where does malaria usually occur? Africa, Central and South America, Eastern Europe, South and Southeast Asia, islands in the Central and South Pacific Ocean, Oceania. What causes malaria? When a mosquito bites someone who has malaria, the mosquito becomes infected. When that mosquito bites someone else, it transfers a parasite to the other person's bloodstream. There, the parasites multiply. What are the signs and symptoms of malaria? Fever and sweating. Chills that shake your whole body. Headache and muscle aches. Fatigue. Chest pain, breathing problems and cough. Diarrhea, nausea and vomiting. How is malaria diagnosed? Your healthcare provider will examine you and ask about your symptoms and travel history. It's important to share information about the countries you've visited recently so that your provider can clearly understand your risk. How is malaria treated? It's important to start treating malaria as soon as possible. Your provider will prescribe medications to kill the malaria parasite. Anti-malarial drugs include artemisinin drugs, artemether and artesunate. The best treatment for Plasmodium falciparum malaria, if available, is artemisinin combination therapy. Atovaquone, Meprin, Primaquine. What are the side effects of medications to treat malaria? Gastrointestinal, GI, issues such as nausea and diarrhea. Headaches. Increased sensitivity to sunlight. Psychological disorders and vision problems. Anemia. Prevention. If you plan on living temporarily in or traveling to an area where malaria is common, talk to your provider about taking medications to prevent malaria. You will need to take the drugs before, during and after your stay. You should also take precautions to avoid mosquito bites. Apply mosquito repellent with DEET, diethyltoluamide, to exposed skin. Drape mosquito netting over beds. Put screens on windows and doors. Treat clothing, mosquito nets, tents, sleeping bags and other fabrics with an insect repellent called permethrin. Wear long pants and long sleeves to cover your skin. What is the outlook for people who have malaria? If malaria isn't treated properly, it can cause serious health problems, including permanent organ damage and death. It's essential to seek treatment right away if you think you have malaria or have visited an area where it is common. Treatment is much more effective when it's started early. When should I see my healthcare provider about malaria? If you've traveled to or live in a country where malaria is common and you have symptoms of malaria, see your provider immediately. A note from Cleveland Clinic. Malaria is a serious illness, but you can take steps to prevent it. You can lower your risk of infection by protecting yourself from mosquito bites and taking preventive medications. If you're traveling where malaria is common, talk to your provider several weeks before you leave. This is especially important if you're pregnant.